We all think of blood transfusions as this incredible life-saving thing, right? I mean, they are. They're one of the absolute cornerstones of modern medicine. But what if I told you that in some rare cases, that very bag of life-saving blood could trigger a catastrophic reaction? Yeah. Today, we're going to pull back the curtain on a hidden danger called TRALI. All right, so here's how we're going to break this down. First, we'll look at this weird paradox, a life-saving treatment that can be risky. Then we'll get right into it. What is TRALI? After that, we'll unpack the leading theory for how it happens, called the two-hit hypothesis. From there, we're diving deep into the cellular chaos it causes, and we'll wrap up with how we're actually fighting back against it. Okay, let's just set the scene here. Imagine a patient, they need blood. It's a procedure done millions of times a year. Totally routine. But then, in a tiny fraction of those cases, something goes horribly wrong. The patient's lungs start to fail. That's the paradox we're talking about today. That is TRALI. And when I say horribly wrong, I mean it. The stakes here are just incredibly high. Look at this number, up to 12% mortality. But get this, for patients who are already in the ICU, that number can shoot up to a staggering 47%, almost a coin flip. So no, this isn't some minor side effect we're talking about. This is an absolutely critical danger. So what exactly is this thing? You know, for a long time, it was kind of a medical mystery. But in the last few decades, scientists have really started to nail it down. So let's get a nice, clear definition. All right, so TRALI stands for Transfusion-Related Acute Lung Injury. And really, what defines it is how fast it happens and where it hits. We're talking about a super rapid onset of what's called pulmonary edema. That's just fluid flooding the lungs, and it happens within 6 hours of getting that blood. That fluid buildup causes hypoxemia, which is a dangerous drop in your blood oxygen levels, and it leads to just severe trouble breathing. And our understanding of this didn't just appear overnight. This timeline is pretty cool. It really shows science in action, right? I mean, we went from just writing it off as some kind of allergic reaction back in the 50s to finally giving it a name in 1983, and all the way to 2019, where the definition was still being tweaked to make it easier for doctors to diagnose. It's been a real evolution, which of course leads to the big question. How does this even happen, right? Why do a few patients have this catastrophic reaction when millions of others are perfectly fine? Well, the leading theory is this really elegant and powerful idea called the two-hit hypothesis. And honestly, the best way to wrap your head around this is with an analogy. Think of it like a forest fire. For a forest fire to start, you need two things. First, you need the dry kindling. This is your first hit. The patient is already vulnerable. Maybe they just had surgery or they have a bad infection. Their lungs are, you could say, primed for reaction. Then along comes the second hit. This is the spark. The transfused blood itself contains a trigger, maybe antibodies, maybe other little molecules. So you've got the dry kindling, you've got the spark, and boom, you get the forest fire. A massive, out-of-control inflammatory storm that just erupts in the lungs. So that forest fire we're talking about, on a microscopic level, it's just a cascade of total cellular chaos. So let's zoom way in and meet the actual bad actors, the culprits behind all this damage. Okay, culprit number one, the neutrophils. Now, these guys are normally the heroes. They're the foot soldiers of your immune system, the first responders on the scene of any infection. But in TRALI, they go rogue. These overzealous first responders become the main agents of destruction. So how exactly do they wreak all this havoc? Well, once that second hit from the blood transfusion flips their switch, they get all activated and start getting stuck in the tiny blood vessels of the lungs. And that's when they go on the attack. They unleash a couple of key weapons. First, they release these destructive molecules called reactive oxygen species, or ROS for short. And second, and this is wild, they literally spew out something called neutrophil extracellular traps, or nets. These are sticky, toxic webs made of their own DNA that just cause massive collateral damage to the lung tissue. But the neutrophils aren't working in a vacuum. Nope, their main target, our second culprit, is the endothelial cells. Now, these are the cells that form the super delicate one-cell thick lining of all our blood vessels. You can think of them as the bouncers or the gatekeepers, deciding what gets to pass from the blood into the tissues. Okay, so remember that first hit from our forest fire analogy, that pre-existing condition? That's what gets these gatekeeper cells all primed and vulnerable. So when the neutrophils launch their attack, the endothelial cells get damaged, and that tight barrier they form, it just breaks down, it gets leaky, And this is the critical moment. The gates fail, and fluid just starts pouring out of the blood vessels and flooding the lung tissue. That is the pulmonary edema. That's what TRALI is, right there.
But here's the amazing part. Understanding this cellular chaos, this whole chain of events, is exactly how we figured out how to fight back. So we've talked a lot about the problem. Now let's talk about the solutions. And when we talk about managing TRALI, there's this really fascinating split. On one hand, when it comes to treatment, well, the options are pretty limited. There's no magic pill you can take. It's all about supportive care, like oxygen and ventilators. But on the prevention side, it is a massive, massive success story because we figured out the second hit, the triggers in the donor blood. Blood banks have put these genius strategies in place. Like they now source plasma mostly from male donors because they're far less likely to carry certain antibodies that can develop during pregnancy. And hey, you don't have to take my word for it. Check out this quote from a recent paper in Frontiers in Immunology. It says, "The morbidity associated with TRALI has plummeted." I mean, plummeted. That's incredible. These prevention strategies, which came directly from understanding the science, have made a huge real-world difference in saving lives. It's just a fantastic win for medicine. So what about actually treating it when it happens? Well, this is where things get really exciting. Because we know the culprits, the neutrophils, the ROS, the NETs, scientists are now developing super targeted therapies. Just look at this chart. You've got strategies to literally dissolve those sticky nets using an enzyme. You have antioxidants to soak up the damaging ROS. Each one of these is like a precision strike, designed to shut down a specific part of that chaotic cascade we talked about. And really, that's the big takeaway here, isn't it? By digging deep and understanding the how, the whole two-hit model, the cellular players, science has already made a once deadly complication largely preventable. And now that exact same knowledge is lighting the path toward making it truly treatable too. It just leaves you with this really cool thought, right? We've come so far in making one of our most fundamental medical procedures safer than ever. And as we keep solving these incredible biological puzzles, you just have to wonder, what's the next frontier? What's the next hidden danger we're going to uncover and conquer in the endless quest to perfect this amazing life-saving medicine?